This is Mommyhood Unscripted, a show about moms for moms.
Hey everyone, and welcome to Mommyhood Unscripted. So glad you found us here. You know, one thing some of us parents aren't prepared for is long-term care, whether it be for our parents or even ourselves. You know, there's a lot of factors that come into play on this topic, and we know that this is a popular issue that so many of us are facing now because people are living longer. And of course, that's wonderful. It's all thanks to medical breakthroughs and improved technology. So what do families need to know, though? And how do we prepare if we do encounter ourselves becoming part of what's known as a sandwich generation? We're going to do a deep dive on that, too. We have Lily Vittayarukskul, who is the founder and CEO of Water Lily. And this is a company that utilizes AI technology for long-term care planning. Lily, thank you so much for coming on to Mommyhood Unscripted.
It's a pleasure to be here. Thank you for having me.
I'm curious, how did you get into this sector of, an industry, long-term care planning?
I agree with you. It's not the sexiest industry to be in, but in a past life, I was interested in being an aerospace engineer, did some work there. But when I was 16, my aunt was diagnosed with terminal stage colon cancer. She
Oh,
was
I'm
a really
sorry.
integral part of our first generation immigrant family. And post chemotherapy, she was just so incredibly frail that we had to navigate 2.5 years of her daily long-term care needs, such as getting in and out of bed, taking a shower, using the bathroom, uh, things that we might be already familiar with as we think about our aging parents and what they struggle with or their grandparents. And so for us, it wiped us out financially. We didn't realize health insurance wouldn't cover a majority of it. We stepped in physically for most of her care at the home. But most importantly, it really tore my family apart to navigate this without a plan. And we don't talk to an entire extended side of our family. It's been over a decade. And so the core thesis around Water Lily is the scar tissue that we develop that every single household on average is going to go through. How can we reduce that scar tissue or get rid of it altogether by using technology to help younger families get ahead of this?
Wow, that's so amazing. And I'm so sorry about the loss of your aunt with her having to go through all of that. It's so interesting because so many of us are hit and touched by things like cancer, and these things pop up and you're not prepared for where to turn to, where to go. We know that there are support systems out there, in the medical field, doctors, there's a lot of support groups. But, in terms of like planning for care and long-term care and not understanding what is coming down the road, that's like very daunting and very scary. And it's so hard. I have a 2 and a 5-year-old and I'm trying I'm trying so hard to focus on them. But then life happens and, our parents, our grandparents, if we have any, aunts or uncles that don't have children, what are you seeing, I guess, in terms of trends, in terms of the sandwich generation?
So, in terms of trends, we're entering into unprecedented times in terms of the amount of the population that is aging today. So, in the US, at least on average, every single household would go through a really serious long term care event that looks like what we went through for my aunt. And I anticipate that happening for my aging parents as well. However, we are entering into a state where it costs $250,000 today, but because of healthcare inflation being around 5.4% is what the CMS projects. And if you compound that, in addition to the 10,000 baby boomers entering into retirement every single day, which constitutes, Gen Xers, parents right now, that's where we anticipate the cost being well over $1 million for those baby boomers by the time, they need care. So we're really at an unprecedented time in terms of cost, as well as just social dynamics. I think we've lived farther away from our families more now than ever before in search of better job or economic positions. And so that's where planning now is more crucial than ever to get ahead of that cost, to get ahead of the logistics, because I think that the consequences are going to be worse now than they were in the past.
Wow, those are some pretty staggering statistics. So you're talking about over $1 million for the baby boomers. Is that per person or per couple?
Per person, per
Oh,
individual.
ouch. Yeah, that's a lot of money that most people do not have, and most baby boomers did not plan for. Especially when we're talking about, salaries like, when they started working in the workforce compared to what salaries are now, the standard of living, everything's gone up. If they haven't invested, in their careers, that's tough. So, what is Water Lily doing? Like, how are you utilizing this AI technology to kind of forecast this long-term care planning?
Yes. So the way it works is with a 3-minute intake form. We understand your social demographic background as well as your medical background, and leveraging over 500 million data points of families that we followed for over 30 years. And we know how they aged and what that looked like and how their family members step in. We can then predict for the person that filled out this intake form, based on households that look like you, what is your likelihood of needing care, what age it's going to begin at, as well as the duration and what that progression of care needs is going to look like. A lot of people talk about long-term care in terms of it's going to be nursing home care. It's many years. You're only going to have if you have dementia. But we wanted to really make the story real and educational to the individual sitting in front of us and as relevant. And so it's usually what we find is, over 90% of cases, we start at the home, but we show you how you gradually need more care over that duration to eventually probably needing nursing home level care that's not always delivered in the facility as well. And by mapping that and getting a sense of your preferences, that's when we could get really precise about what your unique cost could look like, because it could be a lot cheaper than well over $1 million for baby boomers, but that's only if the family members step in and take care of you at the home. And that's not always, that's actually not a conversation that families are having today. And so it's either going to be a surprise on the children's side, either financially because they can't step in to care for mom or dad at home, or it's going to be a surprise logistically because no one could afford it financially and no one just has over $1 million hanging around in their savings account as well.
That's such a good point. Oh my gosh. I feel for so much of the sandwich generation, with what they're going through, because you can't plan for these things and you're trying to plan for your own family and your own future. And, you know, everything our parents, brought us into this world, and we want to help them as best as possible. And it's heart wrenching when you can't help them in the way that you want to financially with what they need, and you're trying to honor their wishes, and you're trying to make sure that everything is lined up so they're getting the best care, and the best resources and the quality. But unfortunately, financially in this country, it does kind of hold us back from providing some of those key things that every person wants for their loved ones. So what are people doing with the data that you guys are finding? Are they going to a financial planner with it? Are they, kind of changing up how they're like living their life and doing things? What are you seeing?
So the primary action that we're seeing on our platform is one, just education and awareness on this topic. Whether someone makes a decision to kind of solve for this logistically about how they want to age, or how do they think about their parents aging, or how do we plan for that cost? What we primarily see is many more people becoming aware of what is even long-term care and what are the associated costs. But the second half of our platform is focused on, how do we help you solve for that, well over $1 million as financially efficiently as possible? Can we do that with $250,000? Can we do that with 100? Can we do that with 100K? And that's where we allow you to put in ways in which you might want to put assets towards this event, which we call self-funding, or if you want to consider insurance, or you already have insurance or other types of financial products, you could actually put those into our system, actually upload them, and we automatically, in a really intelligent way, read through that document of a financial product or whatever self-funding method, and we tell you, and we map it to your predicted trajectory to tell you, how does it fully cover your long-term care needs, or do we need to change something about that care plan, or do we need to consider additional financial strategies? And so oftentimes we see that wealth advisors and financial advisors are having more of these conversations with their clients now more confidently than ever, to try to help their client understand how can we solve for that future cost with as little money as possible. And what's been surprising, though, is we've actually had quite a few folks on our platform that put in a healthier version of themselves. They look exactly the same, but they said, well, what if I was 40 pounds lighter and I wasn't overweight anymore? How does that change my trajectory. And if they see
Mm.
that I'm going to live 5 years longer, or I'm going to have a shorter long-term care event, these people actually go on to lose those tens and 20s and 30s of pounds in a matter of a few months. And so that wasn't an intended consequence of the software, but it's been a really motivating and insightful way that I've seen people try to get ahead of that cost and get ahead of, aging better.
I love that because, I always say if you're seeking out information, data, what are you going to do with it? Right. I remember when I was pregnant and going into my checkups, and they obviously have the genetic testing, and that's some things people opt for, sometimes people don't. And I remember when I was trying to make my decision on what I wanted to do, I remember the doctor saying, because you're just like, oh, I don't know, what if something pops up? But it's important to know. I remember the doctor saying, well, think about what are you going to do with that information either way, either way, what if something comes up, if it doesn't, mainly if it comes up. And I'm like, that is such a good point. So I love in this situation how, you created this, it's proactive, but it's actually like an incentive for people to see data like in real time of, oh, if I'm going to change my health and some bad habits I've had over the years, I can actually turn some things around and it'll be a little cheaper. And oh, I'm going to be here on this earth a little longer probably. So that's great that came out of it, That's a very positive thing, I'd say.
Yeah, I would say the most positive thing that's happened on our platform is one, people are not shelling out as much money as they would have if they would have reactively, paid for care at the point of it where there's, our grandparents going into a facility-based care, or, if we're navigating this for our aging parents right now, if there's a dementia diagnosis. And the
Mm-hmm.
second thing is we're actually changing how families think about stepping in to take care of our loved ones. We have deeper conversations. So part of the insights we also share is not just, what does your trajectory look like and associated costs, but the unique and most motivating insight we offer is we actually predict how much the family members would step in by default if you didn't do anything on this topic. So we can predict how much would the spouse step in, or the children or other family members, for the person we're trying to predict that long-term care event for, whether it's for our aging parents or, it's for ourselves. And what we've actually seen is in 2/3 of the cases where clients report after the plan what they did, in 2/3 of cases, they actually ended up reducing how much the children stepped in or how much their spouse stepped in. And they are motivated to take on that additional cost and solve for that in order to protect the family, because that's what long-term care is about. It's how do we protect the family at the end of the day?
So long-term care, can you kind of define like what that is for people who are not familiar yet? Because I know that, there are some parents out there, who are a little on the younger side, their parents a little on the younger side, and this may be something that maybe their grandparents are going through right now, for example. And I just want to make sure everyone is all on the same page, with long-term care.
Mhm. So, long-term care, simply put, is when you start to lose your independence. So, things that you're able to do when you're independent, such as being able to get in and out of bed, dress, bathe, use the bathroom by yourself, like all these things you're able to do by yourself. They're called like six key activities that allow you to be independent. And if you were to stop being able to do two of those six activities, which is really common if you become very sick, either with a cancer diagnosis, approach end of life with a different diagnosis, or, as you just age and become more frail, you naturally start to lose the ability to do those activities. You start to need help. That's where you see a lot of the aging population have walkers, or they have someone come to the home to help them in and out of bed, or be able to take a shower or use a bathroom. That's what long-term care is. It's just those six activities that keep you independent, and you being unable to do at least two out of those six, activities. And that's where you could qualify for, long-term care services if you financially don't have enough, or if you have a long-term care insurance policy, that's when it also activates as well.
Yeah, long-term care policy. You hear that being thrown around a lot, I think, now. And people are trying to do that, I'm sure, as well, like opting for that to protect the family, like you were mentioning, right?
Mm. Yep, that's correct.
Yeah. And so I guess my question for you is, with this technology, you were saying that there's a decrease in the amount of, is it the for example, the kids in this situation, the adult children, I should say, there's a decrease in the amount of the parents that are heading into this area, trying to not have the load fall on their kids. Is that true?
That is exactly correct.
Wow.
Where what we see on our platform, let's just say, you want to figure out what your future long-term care costs are going to look like because you're already preparing for retirement. You're putting money into your 401k. You're essentially putting more money into the money markets to kind of save up your wealth so that you feel comfortable in retirement. But no one really thinks about, well, how would I actually lose money in retirement? And one of the most expensive things is actually aging. That's one of the largest kind of areas of bankrupting your wealth. And so in that case, if you were to think to yourself, like, okay, I'm already preparing for retirement, how do I think about protecting that wealth I'm developing in retirement? And that's
Right.
where long-term care, preparing for it, becomes incredibly crucial. So if you were to navigate through our system and learn what your future needs are going to look like, and we might say for your children, your two children that you have, that they're going to take on average 5 hours per week when you start needing help with two out of those six activities of daily living. And then that grows on to 15 hours per week. And then that grows on to another like 40 hours per week over the span of 4 years. Of course, that subsidizes costs, but what we see for folks like yourself is that you're actively saying, no, I don't want my kids to go through that. They're probably going to have a family. They probably have their own career at that time. And so we see them zero out those hours. So what they put in the system is, I want 0 hours per week for my children when I start needing help, all the way into the point in which I need the most amount of help, even nursing home level help. And then you figure out kind of financially what we do here. Do we consider financial products? Do I end up being smarter about how I save towards, this event, or save towards retirement? Do I save more money?
Wow. Yeah, that's all so important when it comes to planning. And I'm curious, what is the most common age group right now that's utilizing your platform?
Most common age group right now is 55 to 65-year-olds are the ones that are already thinking about this topic, sometimes with the help of their financial advisor. And we do see some folks that end up, using our system earlier. We do recommend, given the data that we have, that it's folks that are 40 and over that the system is going to be the most accurate for. And also, if you're in the thick of navigating care, or your parents are in the thick of navigating care, what's really cool is you could even put in their data, and we could learn as the priors of what they already needed help with. If they're in a thick of, in assisted living, you're trying to figure out, well, what if they go to a nursing home? Mom just got diagnosed with dementia. What is that going to cost? Do we have to sell the house? We actually can predict what the rest of that trajectory looks like to help out with those decisions and help offset a lot of that pressure from the family having to make, subjective opinions by themselves, where there could be a lot of finger pointing, and we want to get ahead of that and instead have the unbiased platform guide the decision as well, if possible,
And
with data.
that's great. And I was just going to say, data never lies, right? So if you have the data to help back you up, and you have numbers, when you're going to your family, and if they're multiple siblings, or, cousins, or whatever, the family, the tribe, it's important for everyone to be on the same page. So if you're presenting some solid data, it's nice to have a better understanding of what you're going into. And I also wanted to touch base a little bit more on the sandwich generation too. Like, are you hearing also from any people from the sandwich generation and some difficulties that they are being, just kind of hit with? Because I feel like for the sandwich generation, it comes very fast. And once it comes and it hits, I mean, there's no turning back. Like, that you're it for your parents, right?
Mhm. I speak to the sandwich generation actually like all the time in my work, and almost every single one of them is either navigating it right now, or they're really anxious about navigating the events, or they had a health scare with mom or dad. So you're right, the mom and dad is right now the baby boomers, or even the silent generation that are starting to need care, or they had an early diagnosis. So I see the sandwich generation being many generations actually, like in one, that are really struggling to take care of themselves, and they're already being actively asked to take care of mom or dad or even grandparents right now. So this system really is for them, is to help them feel a lot less overwhelmed, have a much more simplified process of like what to prepare for, or even how to kind of push on, the folks that they're taking care of, who whether it's their parents or grandparents or their older relatives, and giving them data and saying like, look, here's like, and have a real conversation on like, here's logistically what I could do for you, and here's logistically where I can't help, and here's how much it's going to cost, and we need to figure out, do you have the money there, or do we need to navigate government resources, or do we need to think about, different care resources that we can actually afford, instead of you kind of getting the premium sort of facility or the premium home care at the home. And so it makes for what I've seen is, for a sandwich generation, it gives them that peace of mind about what they're actively going through for their aging loved ones right now.
Are you hearing anything about, I know coming out of the pandemic, healthcare has just been strapped, right? And we're trying to recover and rebound from that time period. A lot of 24-hour, home care health aides. I have heard of experiences where people, it's very hard to secure it. It's very expensive because a lot of it's out of pocket. And also, unfortunately, like if someone calls out sick, or the schedule, they're strapped, like then it's on the kids, the adult children, to make sure that their parents have what they need. Have you been hearing things like that too? Like just kind of some pockets of where we need to improve, or we need to take a closer look at in terms of the care that's out there?
Absolutely. There's essentially what you just talked about is described very kind of prevalently as the care gap, essentially, where and we actually predict for that, and at Waterlily, where we predict how many total care hours that you need, and we actively see areas in which you only get a subset of those care needs met, either because the children don't live nearby, or the professionals aren't able to come to the home, either because of what you just shared because of scheduling issues, or because they just cannot financially afford that. And so what we're actually seeing is just people are not, our loved ones, our aging loved ones, or if you yourself are, navigating this right now, is that you're not getting the care that you're looking for. If you can financially afford it, yes, you have to deal with the logistics. And if you don't have the layer, even if you financially have enough, if you don't have that layer of, family coming in when like something logistically happens, and that professional caregiver can't come to the home, then you don't get your care delivered, even if you financially had enough. And if you don't financially have enough, or you have to go through the state's social safety net, Medicaid, that's where it's even worse. Where oftentimes they even have a lot less hours that they could even budget per each household that they've decided to take on, if you're not even just on the wait list, if you financially don't have the resources. So that then pushes the children to either live nearby, or for the children to pay out financially, whether they can afford to or not. And even for the kids that are forced to live nearby, because you never prepared for this, there's a huge care gap. You still have to have a full-time job. You still have children that you have to take care of. You can't take care of mom exactly as perfectly as you'd like to if you're also taking care of your sick kid at the same time.
Mm-hmm. Yeah, you're strapped, you're in the middle, hence the sandwich generation, right? And I was also thinking too, as you're talking, financially, if your parents can't afford it and they're in a situation, and if you can't afford it to help them out, um, I mean, their finances, whatever's there, is going to be drained, and then they have no other choice than to go to Medicaid, right?
That is absolutely correct. And even if you go to Medicaid, you're not automatically qualified into the system. I think there is already so many states that have a wait list, and a growing wait list, because of the 10,000 baby boomers that are entering into a retirement every single day right now. And the wave of the silent generation already stressing the system as it is, and many healthcare workers that are leaving the workforce because of burnout. And so the problem is only going to get worse, where if you assume, if I don't financially have enough today, or there's no way that I want to really budget my lifestyle right now, I really want to live it to the fullest, I would urge you to just double think, well, no, what are you sort of doing to your future self? Because you can't always guarantee that the government's going to step in immediately, if not ever in the future, we actually anticipate that in 10 years from now, if nothing changes, over 50% of Americans will who run out of their finances and need to apply to Medicaid, over 50% will end up and stay on the wait list. And of course, that can't happen because that results in massive homelessness, hospitalizations. If it's so sad, I've actually seen many cases where over the holidays, the children have to leave or take care of the in-laws, and their parents need help. And as a result, they kind of leave their parents at the or the parents doesn't have anyone to take care of them, and a crisis happens often at that time, and then all of a sudden mom or dad ends up in the front of a hospital, and the hospital can't bring them back home because no one's picking up the phone, and that just uses up hospital beds as well. So there's that aspect that's we want to get ahead of. And if anything, what we see in Washington state is an example of what happens when families can no longer afford long-term care and the state can no longer afford a long-term care. And that's where you see a long-term care insurance mandate kind of come into play.
Oh, interesting. So Washington State, they have a long-term care, what is it, a mandate?
An insurance mandate,
Insurance
where
mandate.
essentially every employee is required to pay an additional payroll tax
Oh,
in
wow.
order to get some form of a state version of long-term care. But really, that only covers maybe 5 to 10% of your future long-term care needs, so it doesn't cover it fully.
Right.
Or you can opt out of that payroll tax if you own the appropriate form of long-term care protection product, usually a form of traditional long-term care insurance. And I think there are others that also qualify as well, such as hybrid policies, but specific kinds.
I'm not very well versed in the insurance world or even with long-term care planning, but it sounds as though from the little I do know that Washington State is a little bit far ahead in terms of mandating that, though. 5 to 10% is better than nothing in states where that's not mandated. Is that accurate to say?
You're totally correct where it's much better than nothing. But the answer, at least what I see so far, is like even with the payroll tax and how much it kind of covers for the 5 or 10%, it's still not going to be enough. And so those families that might still impoverish themselves, they're still
Hmm.
going to put a strain on the state's social safety net, Medicaid, and
Hmm.
that's where I anticipate the payroll taxes either going to increase. Or there might even be a federal level mandate that actually occurs, as well as, the states start to put a lot of pressure on the federal reserves in some way.
Well, Lily, this has been such an eye-opening conversation. I really appreciate your time, and I know a lot of people out there who maybe aren't thinking about long-term care planning yet. If they listen to this episode, if they watch this episode, they're definitely familiar with it now, and it definitely has me thinking about a lot too. So thank you so much.
Thank you for having me. I really appreciate this conversation, and I can tell you're really empathetic to both, your parents as well as your children, and you're just trying to do your best. And folks like yourself are who exactly I want to serve because you get hit the hardest, and I think you
Hmm.
need the most help as well.
Absolutely. And thankfully, the help is out there with what you're doing as well, which is awesome. And where can we find some more information on what you're doing?
So you could find us at simply waterlily, like the flower, waterlily.com. And that's where we have a lot of free resources and extensive resources on our blog. And if you're interested in signing up, we have a list of financial advisors as well that are more than happy to look at some cases, see if it's a good fit, and give you access to Waterlily to start using it. We've also started partnering with nonprofits such as the Caregiver Action Network, where they subsidize a certain few hundreds of plans per year, and we're doing more partnerships like that into 2025. So please keep a lookout for that, because we don't believe that the family should be paying for our service. We think that partners should be paying for this.
Thank you, Lily.
Thank you so much for having me.
If you like what you heard, make sure to subscribe to Mommyhood Unscripted. Share it with your friends, too. It's available on iTunes, Google Play, Roku, and everywhere else you get your podcast. I'm Nicole Nalepa. Thank you so much for listening. And remember, Mama, you're doing great.